So the current strategies that are being employed are the stay-at-home advice or the stay-at-home requirement, isolation and shielding. And we'll just go through those very quickly. And isolation really is a complicated one. And unfortunately, there's a lot of wordy slides, but there is a good diagram by the BBC, which I've included, which will hopefully help explain the exact requirements for isolation. So staying at home means that only leaving the house for very limited purposes. So, for instance, shopping for basic necessities such as food and medicine. Only going out the house for a medical need. For example, if you had an appointment, and actually most face-to-face appointments have actually been either cancelled or postponed. A lot of doctors and healthcare workers are now consulting by video or by telephone, but actually there'll still be people who need to be seen because there's still illnesses out there, there's still diseases that are still happening. So you may need to go for a medical need, donating blood, a really important one. If anybody feels they're at risk of harm or injury, or they're stuck in their house, they're allowed to leave. They're allowed to go outside and seek help. Or if you're going to provide care for a vulnerable person or helping a vulnerable person. The other reasons are to taking one form of exercise. So you are allowed to go outside to an open area. So it could just be actually your local park, or just around your local neighborhood, as long as people aren't crowding together, as long as people can keep that kind of 2-meter distance from other people, and as long as you're not going in more than sort of 2 people at a time, or if you're going as a household, so the people actually living inside your house, you can go out together, but otherwise no more than 2 people at the same time. Or obviously if you're traveling for work purposes and you can't work from home, then that's another reason for leaving the house. And you can see why from that previous diagram, by putting these quite stringent kind of rules in, people must have noticed how the roads are just very quiet. And that, imagine each one of those people has now broken the chain, and that then allows the virus to stop spreading to other people. And the risk is that, and this is why we have these behavioural insights as well. And personally as well, myself, almost been 3 weeks we've been sat at home. It's very difficult. After 3 weeks of sitting at home, you just want to get out of the house, you want to go somewhere. But we must, really important that we continue to abide by this, and inshallah, we should be staying at home also with the intention of receiving the reward of patience for staying at home and isolating ourselves because of this illness. And inshallah, that just adds a spiritual angle to it as well, inshallah. So this is just a list of all the facilities. I think we're all pretty much aware. And obviously the one most importantly for us was places of worship, being, gatherings in places of worship being pretty much banned, except for funerals. But for funerals, we must absolutely remember in our Muslim communities, it really should just be direct family, and we really need to limit the numbers to 5 or 10 people, and people should feel the ability to actually to tell others that we shouldn't be gathering. It's a very difficult time for the family, obviously, and we all feel extremely sad and sorry for them and upset for them, and we've all experienced and must have experienced it now. But you just have to hold yourself back, and also encourage other people to stay back as well. Inshallah, at some point in the future, we will come out of this and things will come back to normal. But right now, it's really important, again, that we break that chain of transmission. So no public gatherings except where obviously people are living together. So you can, if you're a parent on your own and you've got your children with you, you can obviously take your children and you need to go and do some essential shopping or whatever it is, then you can take your children with you if there's no option to leave them at home. Or where the gathering is for essential work purposes, again, that can happen, but it must be absolutely minimized. There should be processes in place to socially distance people, even in those environments. So you go to work, you can go to work for, if you cannot work from home. Obviously, you can also still go as long as you're not showing any symptoms of coronavirus. And employees, and this is a duty on employers as well, and especially, again, we need to take this information down to the grassroots level. So our Muslim business owners, Muslim employers, who may be, for instance, running a grocery store, they may not be quite aware that actually it's not just the people who are coming into the shop to do the shopping that need to be minding and keeping the social distance and washing their hands frequently, but the employees also need to be given that opportunity. So where possible, I would recommend that we need to dissipate this information out to our business owners, and they may need to just separate out the areas in terms of how far their tills are, for instance, if it's possible, and making sure they're providing ways of stopping that transmission to their employees. I've noticed actually in some chemists and even in some other stores that actually they've got these perspex sheets in front of where the cashier is. And I know it removes that personal kind of touch, but actually, you know what? Right now, it's important that we try and stop the spread of these aerosol and airborne disease. This is the advice for people who might be working in other people's homes. You can go and work in somebody else's home, provided that the tradesperson is well and has no symptoms. You need to make sure you maintain a 2-meter distance from the other household occupants. I would suggest that you, as a tradesperson, do some form of risk assessment. Maybe you may even need to speak to your personal or public liability insurance people just to make sure they're aware and they're happy for you to continue working. Obviously, no work should be done in a household where people are isolating or they're shielding, unless it's absolutely essential. And it goes without saying that if the tradesperson is unwell, then they will need to isolate. Even if they've got very mild symptoms, they should be staying at home and not working. And the police obviously has powers to enforce as well. So they can instruct you to go home. They can take steps to stop children breaking the rules. And they can also issue fixed penalty notices. And obviously there's a lot of in the press recently about what the level of police powers there are and should be. But without this enforcement, then that chain would become difficult to break. And it just takes a few people to continue transmitting. And you can see how, at the end of the month, how many extra cases there can be.